The nurses have been out today. The bandages were too tight, but they're all right now.
Yeah, they're fine.
This visit to 103-year-old Margaret will help her with her lunch and personal care. She's recently returned home after a 4-week stay in hospital.
How do you feel about being home now rather than being in hospital?
I am glad to be home, definitely. After 4 weeks away.
The amount of support she needs has increased, but here in Buckinghamshire, finding enough staff to cover all the demand for home care is now extremely difficult. It means care supervisor Charlotte and manager Vicky are having to step in to fill gaps in the rota.
We are struggling for staff at the moment, so I'm finding, I think last week, at least every night I think I was out doing maybe 1 or 2 care calls.
We do have to pick up the phone and change times. We do have to be creative with the care that we provide. And until we can get some more people through the door to support us with that, then that's the way things will have to stay. There you go.
Today's report says whilst recruitment of care staff improved during the lockdowns, absence because of sickness has doubled and staff vacancies are now rising steadily, with existing staff exhausted and much better pay on offer elsewhere.
How many sicknesses have we had today?
Dr Chris Alden, who runs this care company, also worked on hospital wards helping discharge patients during the pandemic. With such a shortage of care staff in the community, he worries about the knock-on effect on the NHS.
We normally are having to turn down about 8 new patients a day because we don't have the capacity with staff to be able to help them. For us to be in this position before the winter, before the Christmas period is terrifying. So looking after patients now is hard. And can we imagine when the winter comes, when the colder weather comes, people become more unwell?
That's done.
The government says it's running regular recruitment campaigns and is putting an extra £500 million into training and developing the skills of care staff. Alison Holt, BBC News.